Welcome to the Game Changer Experience podcast. We are your hosts, Dr. Dave Kim and Dr. Jeremy Pastor. On today's episode, we're going to talk about one of the most common questions we receive as clinicians. What is the best exercise for insert pain? This episode is going to be a really good one, so come check it out.
You are listening to the Game Changer Experience podcast, where we talk about rehab, performance, and everything in between. This is where we help you navigate common questions and misconceptions in the training and rehab world.
All right, Jeremy. So today, let's talk about one of the most common questions we receive as PTs, because oftentimes when people are in pain, they're like, Dave, what's the best exercise for this hip pain? So let's kind of start us off by telling us your perspective about this sort of question.
I get this question, not just from patients. I actually get this question from PTs also. And I think that in order to even assume that there's an answer to that question, you have to assume that things are very linear and very black and white, right? And I don't like answering this question for people because it's so against everything that we claim to be as, thorough, individualized clinicians. So, typically people will be like, what is the best exercise for knee pain? Or I pulled this muscle, like what exercise should I do for that? And it's like, I don't know. Right. And I don't know because I have no idea. One, that's not enough information to tell me what actually happened. Right. So like, let's just diminish our job as much as possible anyway. Right. It's like, hey, if it were that simple, wouldn't your Google search have worked? Right.
Or
but
YouTube videos.
Yeah, exactly. Like, wouldn't everything that you otherwise would have tried work? Like, why? I think it's almost like they want to deflect responsibility and just have somebody else tell them what they could find on Google. But really, besides the fact it doesn't tell me enough information as to what actually happened, it also, like, I have no information about how to help you, right? It's like your right knee pain could hurt for 12 different reasons. Like every time I meet somebody, I tell them, it's like, Mike, I don't know how to help you yet because 10 people can come in with the same diagnosis, even if it's like a structural diagnosis, and it could be for 10 different reasons. So if I'm looking for a treatment strategy or an exercise on how to help somebody with their pain, right, I want to be as specific to what their body needs as possible. So, like I play men's softball, right? And I think that's kind of like the most common place for this to happen. We're out on the field. Someone comes to me before the game is like, hey, what's a really good stretch for this? And it's like, dude, I want to help you so bad. Like I'm not being dismissive in saying this, but I genuinely do not, like, that is not how we do this. Like, I'm sorry. Right. So like what's the most common like type of pain that somebody comes to you asking for?
Low back pain is pretty common. Hip pain is pretty common. But again, I explain it the same way as you. Like 10 people could come to me with low back pain, but the way they got there could all be different.
Sure.
And so like without enough information, like I really don't know. And that's not a bad thing. I think social media in general has kind of fostered this, try these 3 exercises or try that 1 exercise and that will solve your issues. But it's just really not that simple. I think that sort of culture that's developed is just for clickbaity, viral, self appreciation type of thing. It doesn't really look at the person as a whole. And that, again, it gets away from how we treat people, from a PT standpoint, right? Because like pain is so multifactorial. There's, so many factors we have to consider, like previous injury history, occupational history. What are they doing most of the day? Like sports training history. It could be like mechanism of injury. What are their habits? How's their nutrition? How's their hydration? How's their sleep quality? How's their vision, hearing, red flags, you name it. Like all of these things have an influence, and it's really important to appreciate all of that. And again, like me as a PT, when somebody comes in and I'm trying to treat them, yes, I have a game plan based off of what kind of findings I am finding, right, during that time. And again, like I might have the perfect exercise in my mind, and I put them in those positions and we try to do it. But hey, sometimes it's a home run, and other times it isn't. Other times it's just not the right position for them. Other times they're just not feeling the right muscles, and that's where it's really important to shift, from one exercise to the other. Like a clinician has to be able to pivot.
Sure.
Like you can't just go based off of symptoms and like knee pain. Like you have to be able to appreciate like, oh, what's the foot shape? What's the knee doing? What's the hip doing? How does the upper body have an influence on the lower? And how does the lower have an influence on the upper? There's just so many differences. So I think not trying to bash others, but just more so trying to get people to understand that there's more to this than just simple symptoms.
Well, I also think that so much of what we do is understanding what to do next based off of your response from a previous something, right? Whether it's something hands-on or an exercise. So it's not this like straight linear algorithmic mindset of I already know the 4 or 5 exercises you're going to do. Hey, go off into the corner of the gym and just do this exercise program. Like that is not, in our opinion, that is not a very skilled way to actually help somebody. That's kind of like throwing, what at the wall and seeing what sticks. So it's like if you were to treat 15 people the same way, 6 of them could get better, right? 6 could see no change at all. And then the other 3 maybe even see like an increase in pain, and that's kind of the problem with a very cookie cutter approach in the first place. So if I'm going to say that that's not the type of business that I want to run, because I value being as direct as possible, right? We can't say specific because I think we know like there's no guarantees with anything right, when you're dealing with the body. But, we want to take the guesswork out as much as possible and have some type of like principle based approach or model to go by. Then like, why would I ever want to just give this like, hey, yeah, just do this exercise over there and that's going to eliminate your pain, right? Like maybe even like selfishly, like I don't want my reputation on that bit of advice, right? Like I'm not interested in the clickbait. I'm not interested in like, hey, the best 3 exercises for this. You ever realize how many quote unquote best exercises for something that somebody pushes out? Like, you ever realize how many times that exercise is bulletproof for the knee, even though like they've posted that same title 15 times for 15 different exercises? Like if it were the best, right? Like then that would always be the best. It's right. Not. So I know I'll always get heated when I think about how some people kind of approach the social media world of trying to help people specific to pain, because in my opinion, the only true honest way to help is to tell people there is no best exercise. That's the only honest way. Now, absolutely, could you frame it differently, right? And maybe say like, hey, these exercises could help the body do this, which might help with someone dealing with this pain. That's not as flashy of a title, is it?
So much uncertainty. Don't know what to do with myself.
And I get it, right? It's very non-committal, but it's like, I'm sorry, that's just the reality. Like, we don't know. Do this with this intent, but also do this in this very precise way, expecting this outcome. And if this happens, it means we're going to do this next. Like, that is not an easy thing to tell people. People want easy
all the time. And yeah, I mean, I was guilty of this too. And I'm sure you were when we first started out, right? Like, we didn't know how to view the person as a whole. So what we often did was we searched YouTube too. We've searched Instagram too. Yeah. It's common. And you're not wrong. Whoever's listening, like, you're not wrong for trying that, right? It's a starting point. But again, going back to the point before, like, we need to appreciate the complexity and try to simplify it to the best of our degree, right? And then try to voice it in a way where the patient can understand.
I think the more experience that I get and the better I try to get on the treatment side, the more things that I'm experiencing where that quote unquote best exercise does not help somebody. I could tell you right now where tibial internal rotation did not eliminate somebody's knee pain, even though, that seems to be like the new like flashy thing to tell everybody to do, right? The amount of people that come to me and say, what's the best exercise for hip internal rotation? It's like, right. Like that, that's like the go-to for clinicians to ask me. It's like, I appreciate why you're asking that. And I agree that that is a valuable thing for somebody to be able to express. But please appreciate why there is no answer to that question. I have improved these things by attacking exactly what you would expect, meaning like working on the joint in question. I've improved these things with not even working on the same side, but working on the other side of the body. I've improved these things by working on a completely different joint. You had a post the other day talking about how someone's visual field can influence their shoulder motion, right? So it's like, you can't possibly know this before actually meeting somebody, and sometimes before meeting somebody and doing something wrong, right?
Absolutely.
And when I say wrong, I mean like kind of failing safely. And that's just part of the process.
Yeah, we keep saying like we're failing safely, right? But at the same time, like the way we also view it is we're not really failing. This is just information that we're collecting.
Sure.
So just semantics, right? But again, it's information we're collecting to make the best clinical decision for you.
Yeah,
like we don't want to go based off of just cookie cutter approaches, or like we don't want to go based off a diagnosis. We want to observe you as a whole and then give you the right exercise based off of our findings.
Right. Like if you were to do an exercise and it didn't create the change that you want, what you mean is like that is valuable information. Yes. Like, could you say it's failing in the sense that you didn't get the outcome you want? Okay, maybe if you wanted to look at it from a negative perspective, but it's still valuable because now we could say what stopped this from working, right? But if we just try to think like, hey, I have this predetermined program for every single time a knee hurts. I have this predetermined program for every single time a back hurts. Again, like that is how you basically just live in the middle, right? Again, like you're going to help some people, but you're going to really get frustrated with the amount of people it doesn't help. And if we're talking now from the patient side, now think about the trickle down effect of trying something that somebody, that skilled expert tells you is the best exercise and it didn't help you. What does that make you think about the potential for, your right knee pain?
Right. Absolutely. And then the person starts to wonder, like, is PT working for me? Or like, sure, do I have the capacity to get better? And then they'll start labeling their knee as their bad knee or the shoulder as a bad shoulder. And I am an analogy guy, so I do want to kind of bring an analogy up. So the way we could all kind of view this is, again, like the intent is fine behind asking, like, what's the best exercise, but view it in this lens, for example. So let's say, I'm in Caldwell and Jeremy's in Freehold. If we just generally asked, what is the best way to get to New York City? It's going to depend, and it's going to depend on where the starting point is, where in New York City we're trying to get to, what are the traffic patterns, what access to the highways do you have? There's just so many different ways it can go about, right? Like if you're trying to look for a golf club for you, you could ask, what's the best golf club out there? But again, is it tailored to you is the question. So just when asking the question, I think it would be beneficial if you, well, number one, get assessed. But number two, like if you don't want to do that, try to think of all the factors that could be influencing that sort of pain response. And then, you know what? No, go get assessed.
Well, you know what? I always like playing both sides of the fence and kind of taking both perspectives with a debate, because I think that, I think we're always biased by obviously our experiences and our opinions, right? So, you brought up social media before, and I think social media is interesting, right? Because I think that in order to be able to be exposed to enough people, you kind of have to give people what they want, right? Like that's how you get in front of more eyes, is to post things that are shareable, that people want to share with other people, that have the potential to go viral, right? And it's like, what are people looking for? Well, people are looking for quick fixes, right? So if you title something in a way that someone thinks like, oh, this is going to help me with this, then they're more likely to share, and so on and so forth. So I do think there's an element of what pushes people to do those things on those on those apps, on those websites, is that's what people that are going on there are looking for. Now, right. Again, I guess you get to decide now as the content creator, right? Like, what are your core values, right? What do you believe in? How consistent can you be with those core values, right? Are you going to provide the context, or are you just going to continuously create like clickbait material? I choose to do it one way. It doesn't mean that someone's wrong for doing it another way. But what I will say is this: is it the end of the world trying those things if you're the person in pain? I don't know that that's necessarily true in saying that either, right? We're talking about the perception or the response to if this is something that does not help you, right? Like, I'm sorry, but that 3 best exercises for knee pain does not help everybody. So let's say you decided to try it because you're like, listen, maybe I don't know that I want to invest in working with a professional right now. Maybe I don't have the time, which is part of some people's reality. It's like, okay, then, maybe find somebody that you can get behind, their content. Maybe you do try it, and just understand like what signs would imply like, no, this isn't right for you, or no, I need to look somewhere else for the right answer. So if you were to try something and let's say things got worse, that's a pretty obvious sign, like don't keep doing that, right? But let's say you were to try something and things just didn't get better. We want to avoid having people go down the rabbit hole of now thinking that they're broken because this best exercise didn't help them. So just know that there are still more opportunities out there to be more specific to what you're looking for. There's nothing wrong with being non-specific from time to time, right? It often is the cheaper option and more accessible option, right? So it's I think it's an appropriate first step, right? But then it's like, what do you do in response to the information that you get from that? And I think that's really the bigger picture. And I think that's the fair way to kind of say, like, it's not that it's necessarily bad searching for these things. To be honest, a lot of people try it and then they're like, oh my God, things got better, right? But then because that helped them, right, they swear that this is the reason why that helped them. Right. So sometimes it still continues to create a false narrative. But again, like
just the big game of telephone.
Yeah. Like it's almost like if you did X and X helped you, you think X is the greatest treatment on earth. If another person did that same exact treatment and it didn't help them, they're literally saying that person has no idea what they're talking about. Right. Like that's where the perception kind of deviates, where it's like, how well do we actually understand what we're doing? And can you appreciate why something can help for one person and not for another? And that's kind of like coming full circle and saying like, that's the reason why I personally don't value answering questions like that. I mean, I answer them, right? I just try to provide context, but then it turns into like a 20-minute discussion as to why I can't answer them.
I just leave them on red.
Just kidding. Yeah, well, I mean, I think it depends on my mood for the day.
True.
I think some days I'm better at responding in the right way, better than other days. But yeah. So if I came up to you and I said, Dave, I've been dealing with some knee pain. What's the best exercise that I could do? What is your, initial reaction? How do you respond immediately?
Well, it's easy now. I'm going to be like, go listen to this podcast.
There you go. There you go.
Boom.
And we've done it. We have done it. We've officially made the the perfect bit of content that you can share with somebody when they ask that question now, and you don't have to now come up with the answer yourself. We have made it.
Yes.
Awesome. Well, hope you guys like this one. If you did, please subscribe and come back next time. Take care. Thank you so much for catching today's episode. If you liked it, save it, share it, and leave a 5-star review. It helps us get the message out to more people just like you. We'll see you guys on the next episode.